to start to say, it's been like a while we didn't do a podcast. There's a lot of friends and people on our website always go to our podcast and they hear it. A lot of people, they said, when I go to work, I always put hear the podcast from Women of the World. It make them it gives them so much energy. It gives them so much hope. So we didn't do it for a while. And I thought, well, this is COVID-19 and a lot of people that are going through, all the people in the world that are going through, the COVID-19 or coronavirus flipped the world upside down. Mm-hmm. And unfortunately, we did not connect with our community. We cannot do that is because we have to get be a precaution about this kind of the virus. So I thought it's really, I really like to hear from Anju as an Italian lady, and from Sarah and from Taiba from Iraq, to see their point about talking about what's the advantage, what's the things you're going to get through in this coronavirus. So I'm talking so much. I let you Anju, what do you feel about that?
My experience right now is I'm a healthcare worker as well, so I do have to go on site and work some days, but since I'm on the admin, some days I'm lucky to come and work from home. So good thing is I get to spend time with my dog and work at the same time. Bad thing is it's uncertainty, and lots of people are going, it's not like people say we are on the same boat. We're not, because some people probably have money, some people lost a job and fundings and everything like that. So we're not on the same boat. So it's that uncertainty for myself is not good either, because I'm also pregnant right now.
Oh, congratulations.
I'm pregnant on the fashion show. I don't know if you guys noticed or not.
I'm sorry.
So, being home and then working from home is good, but then at the same time, when I have to go on site, then there is a risk, because I'm also in the vulnerable population. So I'm always worried about that as well. So that kind of, thing is going in there right now. So, and my husband cannot go to the doctor visits right now. It's just me going there. And he is the one who wanted the kid, so. But, as long as we're all safe, that's a good thing, but we're not all safe. And that's what is that thing.
Exactly. Just like you said, really, we are not the same boat. Exactly. The people, we are all in this mess, in this virus. But just like you said, people that have money, they're not gonna be feeling so bad when they're sitting home without job. So you're right. Yes, I let Sarah to share her experience, please.
So, about my experience, so, my husband working as a real estate investor, and in addition to he work with Lyft driver. He's Lyft driver. Okay. So we affected with the second situation as a Lyft driver. So what I did, I joined a group of real estate investors online, just to help with the situation, because the financial issue get a little bit of problem for us. And we have to deal with so many homework online, me and my kids, turning everything online. This is something that I don't like. I don't like to be too much on internet or doing so many stuff online. So this is something that I don't like, but we have to do it now. In addition, I don't like to stay at home. I like to go outside. Even if I don't want to go shopping, I just love to go on Walmart and or Costco. So this situation is really affect my how to say this, mental.
Oh, yes, yeah.
Yeah, mentally.
It has been very stressful weeks, but now it started to get better. Going outside around the neighborhood, I think it's going to be better.
I hope so, yes.
And I hope it'll be better soon.
Yeah. For me, the first like two weeks, or like the first week, was really hard because I think that working from home is really, you cannot focus the way you are in the office, because like everyone around you is just talking about the same like problems, and you're talking with them about what we're going to do. I mean, like we use like WebEx and Google Hangouts and chat, sometimes call each other, but it's really hard, like the first 2 weeks. But now I am getting used to it. I work for Vivint Solar, and a lot of our team got furloughed, and that was really hard for me. And I want them to be back because it really affected our department. And also I feel bad for these people, and they have been working for the company for so long, and now because of the virus and what's all happening, people lost their jobs. And so at the same time, like I didn't lose my job, but I'm still thinking about other people and what they'll be going through with this pandemic, how they're going to pay their rent, the bills and everything. So I don't know, it makes me feel sad. And I hope this will end soon, because especially here in United States, a lot of people have their own business. And these like a lot of people, they don't work for like big companies. They get really affected by this. And
especially the restaurants.
Yeah. So I don't know, I am praying that this will end soon.
Yeah.
So
I hope.
Yeah. And for like my personal life and what I'm doing, so I study at night, and with like the advantage of like working from home is I have a lot of time because I don't have to travel to work and come back, and that takes I work in Lehigh, so that takes like 1 hour or more than that to go and come back. Yeah, so
Big gas too.
yeah, so that's like good for me because I have more time now to study and like be more productive. So yeah.
Well,
and you don't need to wear fancy dresses to go outside.
Yeah, exactly. Yeah,
with your pajama you can do everything.
Yeah, you can just stay here and work.
You want to say something?
I haven't even combed my hair yet, so I'm like, whatever, I'm staying home.
Really?
No makeup.
What about you, Sarah?
Well, my experience actually is I felt like the end of the world. I was so scared, thinking about my children, my grandchildren, all over the States. They're not with me, and I wish to, all of them, they live in my house, and thinking about my family in Iraq as well.
Yeah, me too.
And as a leader, I was, I'm so worried about all the women that I've been helping, the women from all over the world and their children. And I really wanted to go to every single house and educate them about how to be safe, because we, as a vulnerable woman, it's really hard to come to their mind, okay, I have to stay away from this person. I'm supposed to wear mask or wear gloves or clean my hand. I remember the first week I went to take some some like cleaning things for one of the lady, and I wanted to put it nearby her house. And I did call her and I said, I'm not going to be inside because I have underlying, disease. So I don't want it to be expose myself in there. So I had my mask on and glove. And when I went in there to give her the stuff, she saw me and she opened the door. She said, please come inside. And I said, I'm sorry, I cannot go inside. I don't want to give you what I have, and I don't want to get whatever, God forbid, you have for me. She was upset is because this is not the way it's supposed to be. You are our leader, you are our mother, you help us, and you are scared from me. And this is the way she has kind of cried, and I was far from her, still a distance, and crying. I said, no, really, I really love you and I wanted to hold you. I need some hugs, but I cannot do that, for you. So this is one of the things that's really hurt me so bad, is because, do they have enough food, especially the oldest folks. I always, call them and say, if you need food, I'll go and shop for you and bring it to you. So it's really hard for me. As women of the world, we did not stop working. We are working from phone, on the phone and Zoom, and we go and we give to the women what they need and all these things. Even apply for employment, and we apply for a job, apply for food stamp, apply for this. All is going, always we are working and all these things. But the community to gather together in Women of the World is not there anymore.
And it was a big thing actually in Women of the World.
Yeah, because the women, they wanted to have that, when you're going to open your office so we could be in there and meet from a different country in there and everything. It's unfortunately that the community gathering and the safety net is gone. Everybody is kind of scared, and especially when they see me as a leader coming to them, I want to hug them, is because I love to. I really want to. Yes. But when and the other things is what make me scared is because 40 years I've been living in America, and when I tell my the ladies that are from Iraq, they said, "Oh, curfew, we always have curfew because the war is going."
They're like used to it.
So we used to it, this is bad, but some of the ladies actually, they are, of course, they are very scared, and they wanted to go out to pay for their rent or to do money order or something like that, or to buy some grocery, because they said in Utah you're not supposed to go out. They were scared if they go driving through in the bank to do money order, because they thought, oh, the police, they're going to stop them and put them in the jail. And I told them, no, it's not going to happen this way too. So there is a lot of things, that is kind of bad happen. And just like all of you said, I wish this one, we find the cure for it, and we find the what they call it is to get this, of course, the test is more tests is going and all these things. We are going to open the office, but it's going to be like a slow in June, like on call or on one by one, coming, slow, we take it, see how we could help those ladies. And and unfortunately, just like Anju said, is affecting the people that they are working and now they are unemployed. If women, they are unemployed, or their husband, they don't know. I mean, the landlord needs rent and they don't know how to get that. And we are trying to apply for grant or anything that we could get some money for the women, that when they go back to work, how they pay the landlord for that, So, and of course, food. I know there is food bank, but sometimes they like to go and shop for the food what they need, and all these things.
Mhm.
So,
Yeah.
yeah.
It's, I don't know, like some people say that this is gonna take like 1 year. So it depends on when the vaccine will be like there. So I don't know. Well, hopefully soon.
To get a vaccine, you have to have at least 18 months, because you have to have people with the antibody positive on that. And our lab where I work is actually doing that antibody testing right now.
Okay.
And what happens is, like, you have to have certain kind of population, and then they go through clinical trials, and you have to try that to them, and you have to find a positive person, and then they need to be cured, and then the second wave will come, and then they will try on that, and then after that the vaccine takes a little time.
How
And
long do you think it's gonna take?
usually, like, I'm not this, like, I'm scientist, but I'm not the one that
You're working on
but with my experience, I can say, like, any vaccines they take 18 months at least.
18.
At least.
And then after that, the priority will be the healthcare worker who are working in the front lines. And then after that, other people will be able to get the vaccine. So it's a little sad to say, but that's what the truth is. And right now we just have to be careful and
Yeah.
and then just
And educate each other about taking care of ourselves. Yeah, just like what Samira said about this woman, that she thought that Samira is not like doing and she's actually, she like what Samira did, she's actually like thinking about her, and she doesn't want to like affect her or do some like burden or something bad to her. But she didn't like understand it. So we need to educate people more about taking care.
I guess the vaccine will be able, because CDC, FDA will approve it on emergency cases like this, and all the tests are we can do the testing because it's not FDA approved, but it's emergency use. So that's why FDA allow us to use those emergency use only kit, because we don't have any option right now. It just came all of a sudden, right? So vaccine, I guess they'll start doing the emergency use first and see, like, before going to clinical trials. And they will do the clinical trials on the side, but at the same time, they probably will be using the same vaccine for the people who are working on the front lines and all that. So hopefully there is a good news and all that, but who knows? This is very uncertain, so.
Yeah,
and then Samira is trying to help people, and some people are, so I understand that.
Yeah.
Well, I mean,
because it happened with me too. Like my neighbors, I was like walking in the park, and I was like, like far from her, like 6 feet or more, and she was like, "No, I'm okay. Like I don't have anything. You don't have to stay away from me." I'm like, "No, it's just something that we have to like think about it, and we have to like take these precautions. It's not that I am think that you have something you're gonna hurt me, but
you may have something that can hurt her.
Yeah,
so
exactly.
You probably cannot show the symptoms because you're young and healthy and all that. But at the same time, you can spread that easily to other people.
That's right.
And some people can just go through with this with little sneeze and cough, and they think it's just the allergy, but maybe they are carrying it, So it's
Exactly.
There's, we have a lot of education. We need to talk about it, but I hope my ladies, when I go and visit from far away, they don't take it as a personal, because just like you said, they need to. Unfortunately, because they are so generous and they are loving each other, and they think this is not supposed to be happening. But I called my sister in Iraq, and I told her how is it in there, because in Iraq they have many people. It's really hot weather in there, and they thought it's gonna go low, but no, it's going high. Is because of the people is special, by the way, today is the Eid, and I wish
yeah, Eid Mubarak.
everyone,
Thank you.
happiness and health and peace and but so what she said the people, they start to wanted to prepare for the Eid, they start to go out, and the virus went higher, now. So it's really kind of a scary time, and she, of course, my nieces is a doctor in there, and they are in the front line and all these things, and they're always telling my sister, to stay home, and they will do the grocery and all these things, so it is, hitting for all over the world, but I hope and I wish, they could get that vaccine ready and prove, and everyone could go through this moment, is really a hard moment. Yeah.
And then there's another education like they need to do is like some culture, they take it as a social taboo.
Yeah.
So like if you have some virus or something, they try to hide it from people. They think that people will hate them, or they think it's like a social taboo. Like it's not, it can happen to anybody. It happened to the Prime Minister of Great Britain. It can happen to anybody. Our mayor, Ben McAdams, So it does, and people don't understand that this is disease, and it doesn't differentiate between people and all that. But people try to hide it because they think that they will be separated from the community, and which is sad too, because then they are spreading some. And then I have the data, like somewhere I was looking at the data, and they're saying that minority population are more in danger right now, because minority and then little poor people, they live in contained place, and then they live in the same places, and lots of people stay in the same house, so one people get infected, lots of people get infected, and I'm not sure because of nutrition or because of some other thing, they are the one who are getting more casualties than other people who are making like being well off. So
this is a great point you brought, Anju. So the ladies that are coming from Africa and from Middle East, especially the Muslim people too, they don't want to talk about I got the disease. Why is they think is God is punishing them because they are bad people. They don't want to talk about it loud. Oh, I got this, the virus. And the other thing is, the Muslim people, I don't know about the other religion, but the Muslim people, they don't want to say I'm dying, this person, or my mom is dying is because of the virus, is because what they do is they take the body and separate it from the family, and there's no such things as in Islam. In Islam, they have to wash the body. You don't put the body in the grave like that. So that's unfortunately is between the women that is in here too, and I heard about it, from my sister, in Iraq. She says something is like that too, unfortunately.
Yeah.
So
yeah, there are some areas in Iraq that people, if they like get the virus, they don't like tell anyone, or they don't. It's just because what you just said. They don't want to be separated.
That will insult them or something,
Yeah.
About that, it's a disease. It's okay to. I mean, it's not okay to have virus, but if we have it, it's okay to express that and be careful and not to spread to other communities, So.
That's in African ladies as well, from a different part of Africa. They brought this kind of things, I don't want to tell I have that coronavirus is because God punishing me, and people are not going to like me anymore or whatever. Yeah, unfortunately, that is the culture what make them think about that and take it. They don't take it serious, we need to talk about it. So that's why we have always to wear mask. I've been sewing masks, giving masks, got some gloves, but unfortunately still I cannot get sanitizer that much. As every time,
if you go in the morning to the stores, you can find some early in the morning.
And they tomorrow, no, not tomorrow. It's going to be a holiday, I guess. Yeah, I will go.
Yeah.
Yeah. I've been ordering from Amazon as well.
Oh yeah, that's good.
Mhm.
Yeah.
But we need a lot, because we have couple thousand women that we
Yeah.
about, so we need more.
You can prepare it at home, I think, with olive oil,
Yeah.
aloe vera, and something, I don't know. But I have the ingredients to prepare the sanitizers at home.
Okay. How about you?
When I didn't try it, but I saw people who made it, and it's work.
Okay.
I can send it.
Maybe whoever is hearing us in this podcast, they will call us the next day and tell us, we have some, we're going to be for the women of the world. So we can, we got these too. It's a small.
I saw some on Costco yesterday too, so maybe they had a lot.
Oh, really?
I think, yeah.
Yeah, it's the spray kind. It's
Where?
Where? Costco.
Okay. Yeah, I'll go there, because
there was a lot yesterday when I went there.
Oh, really?
It's not
I couldn't find in Sandy, Costco in Sandy, but maybe it's on the main street in Midvale. Mary.
I saw that on Murray Costco, 53 on South Instead.
Yeah, I couldn't find in
and there was
Sandy.
a lot yesterday, so hopefully. And they are limiting for people, so they don't.
Sure.
Like before, people were hoarding, they cannot do that anymore. So yeah, maybe you'll get it if you go there. And the spray kind, I think some distillery, like they made it, like some of the, so the brewing companies, they made it because they can. So.
Yeah, unfortunately today I went to the Costco. The one is way on 1300 East. Sorry, it's 1318. I'm not sure.
1300, the big Costco. Oh, I don't want to do that.
Zero.
That place is crazy. I usually go to the Murray one, so if you go there, maybe there is, and probably go a little earlier in hours.
Okay.
So it's easier.
Okay.
But there was a lot. Like, I mean,
that's really great. Yeah. We'll do that. Yeah. Please share a story. Oh, have you heard any of your neighbor, friend had this disease and got the coronavirus?
No.
With the HIPAA, I cannot, but I know some people who had it, but they are healthy and all that, so they were able to recover sooner.
Okay.
Yeah, I know some people, but they're not in Utah.
I cannot say who and because So.
Yeah.
Surah has been to get some symptoms, but then when he tested, it was negative.
Okay.
Just have some problem with the chloride. Clorox. He uses Clorox a lot.
Because I have asthma too, allergy-induced asthma.
Yes.
So whenever I use the cleaner, I get that little cough.
Yes, same thing.
Not virus.
No, not the virus.
But right now, anybody like sneeze or cough, they are like, what?
No, I do sneeze a lot because I have allergy every time.
Yeah, me too.
Yeah. And how about you, Taiba? Did you hear anyone has it? And okay.
Yeah, I know some people who had the COVID-19, but they were not in Utah. But it wasn't that hard. So they stayed at home, and they stayed at home for like 2 weeks, and they didn't see anyone. They didn't see their families or anything. And yeah, they feel good now. But when I called them during these 2 weeks, it was really hard for them to breathe at night. That's what they told me. Breathing at night was really hard, but thank God they feel good now. Yeah,
that's good. Yeah, it's hard.
And so they were athletes. They used to go hike and stuff. So I think because their lungs and I think it helped them. That helped them because they were really they used like to go before getting the virus, they used to go like run and stuff. So that helped them. But still, like at night and when you go to sleep, it's still hard to breathe when you have COVID-19. So yeah.
Hope you all be safe.
Thank you.
For a walk with my dog, and when I go walk with the dog and I see people that are walking the same close to me, I go to the middle of the get out, and I looked at I said, oh my gosh, look at me, I'm scared from the human being than the car come and run over me. Really came really so worry about, of course, this virus, and I hope and I wish everyone get healthy and we get the vaccine ready. And I wish you all the health and happiness and peace for all of you. Yeah.
Thank you so much, Samira.
Yeah,
It was so nice to hear.
Thank you so much for this.
You and see you.
Thank
Mhm.
you. Thank you. And
Thank you so much.
You are very welcome. Thank you so much, to share your experience, to share your word for the people, and hopefully a lot of people that will hear it and understand how we take it from person to person is different and all these things.
Yeah. But it changed my mind, like looking at our life from home. I don't know, it really changed my mind now. It makes me think about like humanity and people more than like other things, like more than like money and
That's right.
our jobs and like we always think about how we're gonna make money, how we're going to buy a new car, get a new home or something. But then you think, oh, I need to be healthy.
We have to help the community.
Yeah, I have to be healthy first and think about being healthy and then start thinking about other stuff. And I wish that everyone be safe and invest this time at home with something that they like.
Yes. Just like Taiba, if it is a rich person, a billionaire, or a poor homeless person, both they get this.
Yeah, exactly. They're both living the same experience.
Yes, but of course, with the money, I don't know this. They will get him. What they call it is a doctor and the room and all these things. And I don't.
Oh yeah, that's really sad.
It's the same here, but it's not the same for both people. So
one
suffer more than others. So
yeah. I mean, who is a priority? They will choose that. So that's why I say I always, think about vulnerable. I forgot the word. Vulnerable people, and I do think about homeless. I think about refugee, displaced people, forcibly displaced people. I always think about that, and that's why I left my work and dedicate myself to help those people. But I wish everyone will take lesson from this coronavirus or from COVID-19, that to be nice with the other people, to just like you said, Taiba, it will change them, for humanity, to change the people that have a different thinking about the displaced people or anybody that needs.
Exactly.
That support and to be with them and to say hello to them, to be friend with them. Yeah. Well, I'll say thank you so much for your time. I know it's
Thank you.
Yeah, you're welcome. Thank you so much. It was so nice to talk to you.
Nice to talk to you.
That's right.
Yeah,
nice to see
you. Nice to see you too.
And ma salama and peace be with you, all of you. Thank you so much.
Stay safe.
Bye.
Eid Mubarak. Bye.
Eid Mubarak for you. Bye.
Mubarak. Bye.
Bye-bye. Namaste.